Greetings on a particularly murky day in my hometown of Emsworth. This is actually one of my favourite places for winding down at the end of the day. And it turns out that winding down before you go to bed isn't just good for your sleep. Last week I talked about the importance of circadian rhythms for your health, and this week I wanted to share a new piece of research which builds on those ideas. It's all about blood pressure. Blood pressure being a measure of how hard the blood is pressing against the walls of your arteries. And it changes in response to activity, or if you're stressed, it tends to go up. But there's also an underlying daily rhythm, so it gradually increases throughout the day, peaks at maybe 9 o'clock, and then starts to drop off before you go to sleep. And for most healthy people, blood pressure is actually at least 10% lower overnight while you're asleep. But if you have raised blood pressure or hypertension, or if you don't show that nocturnal dipping pattern, it actually means that you're at higher risk of heart attacks, of stroke, and other cardiovascular diseases. So, given this dipping pattern, scientists wondered, is there a good time of day, a better time of day, to take your blood pressure medication? And this is a question that Spanish researchers set out to answer. So they recruited 19,000 patients with hypertension, and they randomized them into two groups. Either take all your blood pressure medication in the morning, or take all your blood pressure medication in the evening. And they followed them up over 6 years. 6 years later, almost 1 in 10 of those patients had either suffered a heart attack, a stroke, a heart failure, or they'd died. But interestingly, the patients who took their medication in the evening were at almost half the risk of a cardiovascular event compared to the patients who had taken their medication in the morning. They also had lower blood pressure, and they were more likely to show that healthy nocturnal dipping pattern. Why do I mention this in the context of sleep? Well, actually, if you are routinely sleep deprived, and that might be because you're not sleeping for long enough, or you're suffering from insomnia or sleep apnea, you're actually at increased risk of developing high blood pressure in the future. Now, there are lots of lifestyle measures that you can take to reduce your risk of high blood pressure, including cutting smoking, cutting down on alcohol, a healthy diet, regular exercise, or just reducing your exposure to stress. All of which are actually going to be really helpful for your sleep. But if you do end up taking blood pressure medication, ask your doctor about taking your medication in the